I just think it's rude, ignorant, thoughtless.
Your risks far outweigh the benefits.
It's up to me to weigh up the circumstances that I'm prepared to risk.
I just need to have my testicles checked. When I swing over, they sort of go glump.
Oh. You're in pain, Mum.
Oh.
Doctor, can you put your finger up my bum, see if I've got a lot of poo up there?
I mean, if I was good to go, fine. But I don't want to find I'm going to spend months almost like a vegetable.
There are some risks of people having a stroke. The worst case would be that you didn't make it through.
Yeah.
Good morning, Putney Mead, how can I help?
That will be Dr. Neal, and that will be between 9 and 11 this morning.
We've got one appointment left, 8:38, that's doing well. I remember sometimes for 8:09, we've booked it all out, literally.
So, because we've got a bit longer, what I've done is sort of made a bit of a list of things to talk about. So, why don't, before we go into that, were there other things that you wanted to talk about today?
Doctor, can I ask a question? If a woman is married to a bloke and he beats her up, like black and blue, right? And she comes and sees the doctor and he says, where'd you get that? And you said, is your husband beating you up? And the mother, turns around and says to the doctor, yes. Can the doctors do something about it?
Why did you ask that?
Can they do that, doctor? I know everything's changed now.
What makes you ask about that now?
No, it's... I wanted to ask you.
Well, of course, we could always help.
I wanted to ask you, didn't I, Richard?
Yeah, because we was what's that, trial and retribution.
Oh,
It's like...
It's always like this, Doctor. A man shouldn't hit a woman and a woman shouldn't hit a man. See, so...
No, we never done nothing, nothing's done nothing like that at home.
No.
The staff have been very good.
Yeah, okay.
Anyway.
But you two are all right?
Yeah, fine.
Yeah.
And you said you was going to mention the doctor earlier about your bum.
Every time when I eat something, he goes right through my stomach. It gives me diarrhea. And my bum has been very sore. I've been wiping it, but it's been very itchy.
Okay.
And when I go, I pass winds in my bum.
Yeah. What about pain in your tummy? Are you getting anything?
No.
Does your tummy get bigger, have you noticed?
No.
No, it doesn't sort of puff out.
Yeah.
Okay. And from what you've said before, it sounds like there hasn't been any blood in there or anything.
No.
No, good. Okay.
No.
Fine. Is it better when you're not going to the loo so often?
I know when I do a big poo, my bum gets very sore.
Yeah.
Oh, it's very sore.
Okay.
You have to give it a few flushes before it really, gets rid of it.
Yeah, yeah.
You know what it's like, Doctor.
I do.
Yeah.
Oh, dear.
Hello.
Good morning.
How are you?
Not good, not good.
Oh.
I had the worst cough and cold I've ever had in my life.
Did you?
I had paroxysms of coughing every few seconds. In the end, I had to just hold my mouth shut and just cough internally. because it was tearing my lungs apart. It's a cough that comes from down here. It's not a light cough. It's really a hacking cough.
Right.
I call it my graveyard cough. You see, it's very difficult for me, and I don't really expect you to believe this, but the work I'm engaged in, there's a lot of occupational hazard.
What is it you do?
I'm working in a healing ministry, it's Christian healing ministry, and of course it overlaps a bit with what we call the deliverance ministry.
People will go off on tangents often when they're talking about their problems, and actually it's not really, not all of it is very relevant to that particular problem. Although they may think it is very relevant, it doesn't help us diagnose, make a diagnostic decision really about what the problem is.
When you go into the enemy's territory, he doesn't like it. And the devil is extremely clever at coming in under disguise. I mean, this morning, I just suddenly felt so ill. And then I thought, oh, this is just his back to his tricks again. And I find that it's what I call an attack from the other side. It's not a genuine thing.
Right, well, with regards to your cough, I'm just wondering what the next step should be. I didn't really address it. It was one of those moments where you just think, well, that's a bit, I don't know where I'm going to go with that. Sometimes one of the medications can cause your ankles to swell,
yes,
and one of them can cause a cough, so I'm a bit reluctant to increase any unless we need to.
Yeah.
Now, I think the sensible thing would be to check your blood pressure again in a couple of weeks, and then we can make a decision.
Yeah.
Okay.
Well, thank you very much.
Good morning, Putney Mead. Rachel speaking.
My stomach's growling already. It just went... Can you get me some peanut biscuits and a packet of McCoys or something, please? Thanks. Bye.
Oh, is it one of your homemade concoctions?
Well, me and my mum made it.
Oh,
yes.
what's a big bit?
Come in, have a seat. Nice to see you again. Yeah, how are you?
Yeah, good. Yeah, well, yeah. I really just want to renew my medication, really, and
yeah.
But I've got a bit, I must admit, Dr. Vajo, could you help me out with something to sleep, please? Because I think I'm sort of, I know my brain would just want to let me sleep, you know what I mean?
Okay.
I was sort of becoming a bit insomniac and only getting sort of a couple of hours, you know what I mean?
Okay, why do you think you're not sleeping?
My brain just won't let me, you know what I mean? There's too much going on, like, I'm trying to close my eyes and I'm not happy, you know what I mean? No.
Anything in particular going on in it that you think might be stopping you from sleeping? Is there anything upsetting you or stressing you?
Probably, yeah.
Okay, and what do you think those things are?
I can't put a finger on it, you know what I mean?
Can we just check you over a bit? Is that all right?
Yeah, sure.
All right, okay. Just want to take your jacket off for me. Just undo that for me.
I can't. I can't.
So you're living in a tent at the moment?
Yeah.
I think I've got that. That is it.
My dad's a dentist, and he suggested maybe having metronidazole.
Okay. I think there's always a strong argument if things are improving to hold off. Metronidazole is not the nicest drug.
I actually wanted to see if I could get some amphetamines.
I wouldn't necessarily be happy to prescribe sort of amphetamines.
And how about steroid injections? Have you?
I want to do the hyaluronic acid or whatever it is that they're doing. That's what I want to do.
I appreciate if you can prescribe me with some diclofenac.
Okay. I'd probably just use paracetamol and ibuprofen.
I prefer not. Diclofenac is the best solution for me.
Take a seat.
Right. Yeah, the reason I come to see you is out of the blue, they stopped my climber valve.
Right.
Now, I knew nothing about it. Was stopped because I should have seen someone in March. Nobody told me I should see someone in March with this electronic stuff. How do you know?
But the pharmacist should be relaying anything that we pass on, so that it's because it's a new thing. I think there will be some hiccups. So I'm really sorry if it hasn't worked out for you.
I've been attending this surgery more than time in my life, probably. And I just think it's rude, ignorant, thoughtless to actually stop something without even telling me.
It was stopped in June.
But you see, because I only take one every other day, Dr. Andrews, I wouldn't have ordered them since then.
That's absolutely fine. But as responsible prescribers, we have to know that you've understood the risks of being on HRT at this stage in your life, and we have to document that. So, you know, your risks far outweigh the benefits at this stage when you've been on it for this long, and that's what all the research is saying and continues to say. So I think it's really just so that we can be sure that you understand that staying on it increases your risk of breast cancer, increases your cardiac risk. There are other, you know, it does carry risks with it.
But so, I think it's up to me to weigh up the circumstances that I'm prepared to risk.
It is entirely up to you, and our job is to be absolutely certain that we just keep reminding you what those risks are, because that's what our job is. So it is entirely up to you. I entirely agree with you, but that's what that's about. That's what's happened. So
well, if I'm
I can
told,
reinstate it. Yeah. So I'm not going to put this in your Dosset box in that case.
Right.
But I'm going.
Oh, that's right.
Yeah, exactly.
Just leave it to me to order it. Excellent.
Good.
Anyway, lovely to have met you.
And you.
Dr.
I'm glad we
Andrews.
managed to sort that out this
Well,
afternoon.
because I came in here absolutely. I had steam coming out of my ears. I really did. And said that I was going to sit downstairs and sing "I Will Not Be Moved" until I saw somebody.
She means it.
Hello, Patty Leeds, Lorraine speaking. How can I help?
Hi there, are you okay?
My GP surgery doesn't do injections, they don't do blood tests, so actually this is an exceptional practice, to be honest.
How much do you normally drink in a day, Stephen?
3 or 4 strong cans a day, I suppose,
And any thoughts of cutting back on your alcohol or getting a bit more help with it, or does your outreach worker help you with that?
Yeah, well, it is from a drug and alcohol organisation, sure.
Have you got your outreach worker's number?
Yeah, I have.
Can I have it?
Yeah. Yeah, his name's Charlie. Sorry, mate. No,
do you want me to do it?
Yeah, if you can.
Yeah.
Yeah, do you think you can do it? Oh, someone's right. Oh.
That's him.
Yeah. Is that Charlie?
Yeah.
Can I talk to him? All right, Charlie.
I can speak to him, actually.
Okay, no problem.
I can speak to him, actually.
Yeah, sorry, I'm with my doctor. He'd like to talk to you.
Oh, yeah, okay.
Yeah, I'm here now. Right. There you go.
Hi, is that Charlie?
It is Charlie, yeah.
Charlie, hi, I'm Dr. Buveja. Stephen's just turned up to see me today. I was actually just asking him to get me your number. I'm sure you might be a bit busy at the moment. Do you mind if I give you a ring maybe in the next couple of days? Is that all right?
Oh, that's fine. Yeah. Give me a call tomorrow.
Yeah, cheers, Charlie. Bye.
Bye.
Is it all right if I talk to Charlie about it?
Yeah, of course. Yeah.
All right. I think today you seem a little bit like as if you might have had quite a lot to drink.
I've had a bit to drink.
Yeah?
Okay.
Will you make an appointment to see me in about a week? Is that all right?
Okay.
And maybe next time just come with a little bit less alcohol on board, if that's all right. Just so that I can understand you, really. And that we're not jumping around. Is that all right?
I know where you're coming from. Right.
Thanks very much.
All right.
Cheers.
All right.
All right.
Lady needs an urgent appointment, so I'm going to put her on now.
Doctor, just do me a favour. Can you put your finger up my bum, see if I've got a lot of poo up there?
Well, I think it'd be helpful, actually. Yeah, let's do that. Just relax, Teresa. Well done. Sorry. Well done. Good.
Good boy.
We'll talk about it in a sec. So get yourself dressed first, and then we'll have a chat
Is my
about it.
bum sore?
Doesn't look too bad, actually.
Have I got poo up there?
No, nothing that I can feel in your bottom, but it doesn't mean it isn't higher up in your tummy. So I'm just going to have a look at the computer to see if we had that X-ray of your tummy, all right?
All right, love.
Yeah, so hold on a sec. No. You do have to go to Queen Mary's for your X-ray of your tummy.
For my tummy?
Because an X-ray can help us when we're wondering if there's lots of poo in your tummy.
Yeah.
I think that'll be a helpful thing, because I'm trying to get a reason why sometimes you're having these runny tummies, really.
Yeah.
Is that all right if we get that done?
All right, love.
Okay. So get them to make the appointment for the blood test and for that thing.
Oh,
Okay.
thank you, doctor.
That's the blowing test. There you go.
Oh, thank you, doctor.
And do you, what soap do you use?
Well, I use body wash, my darling.
Because I think your soap maybe dries your skin out a bit.
If it gets bad, I'll have to come to you.
Okay.
Sure, I like your jacket, by the way.
Thank you very much.
It's nice, isn't it?
Richard, leave Dr. Ernest's flowers alone.
Okay. All right then. I'll see you soon.
All right, Doctor. See
Take
ya.
care, Richard.
Bye.
Bye-bye.
When I grow up, I will be a doctor.
Do you?
Yeah.
Oh, it's a very interesting job. You get to meet lots of lovely people. Oh, oh.
Warm this up, shall we?
Hello.
Oh, you're quite heavy. If you open up nice and wide for me and say ah. Say ah. Hello, sweetie. Is it a bit tickly?
Yeah.
Is that a bit tickly?
Yeah.
Come in. Hello, Mr. Hi. Hi, come on in. Hi there. Come on in. Right. How can I help?
It's just sometimes I get palpitations and I get the odd dull pain in my arm.
Can you describe it?
Just like a dull ache, really.
Look at that helicopter.
It's like a headache feeling, but except in your arm.
And how long would it last for? Is it all there all
A few
day?
seconds.
A few seconds.
A couple of minutes.
Couple of minutes, okay. And what are you doing normally when it comes on?
Right, can you and let me talk to the doctor? I just ignore it. Just getting on with things.
Okay.
Ashley, please.
Ashley.
Ashley, right. You've been warned so many times now.
Probably you
Right,
should
now,
maybe
come and
not
sit
touch
down here now.
Thank you. Sorry, so...
I was recently diagnosed with a hiatus hernia that came up in a chest x-ray.
Mum, I think there's going to be a storm coming.
I can't concentrate. Please, can you be quiet?
Look, I think there's going to be a storm
No.
coming.
Probably right.
It's not. It's going to be sunny until Saturday. Right, can you stop?
There's lots going on, isn't there? How are you managing?
It's tough, but I manage.
Managing.
I've got gallstones, as you know.
Yeah.
I've had a history of gallstones.
Right.
And I've also had a history of heartburn.
So, and what was it
indigestion.
If you've had this as the same pain for some time, what was it that made you call up today specifically about this pain?
Because I keep feeling lightheaded.
When did that start?
Just this week.
All right. Has anything else changed recently?
No. Ashley, please.
Some consultations are completely chaotic. And that can be because of the GP, the things that the GP is dealing with, or the chaos of the patient's living. And you can literally see it playing out in front of your eyes in the room. It's quite difficult to keep focused. And I'm always worried that I would miss something. And that's often where the discomfort is for me. I actually think it might not be a bad idea to get some tests done to rule out the heart as a cause of this, okay? And actually, probably the best way to do it would be through the hospital for the cardiologists.
I'm okay, yeah.
All right, so you'll hear from them.
On there, yeah.
Blood pressure and the pumps.
Brilliant. Thank
All
you
right.
very much.
Look at me. Look at me.
So I think I do keep my cool, but I worry that I've missed something. As people walk out and as the chaos leaves, I'm always left thinking, you know, what have I just missed? There's something else there.
Hello. Is it Mr. Morris?
Yes.
Hello, I'm Dr. Ernie.
Yes, good morning. I usually see Dr. Andrews,
Yes,
a
I
good
saw
relationship, but this is a man thing.
Okay.
It's not a matter of embarrassment, it's just that
Yeah, that's fine.
she doesn't have a penis. You do.
Okay.
I just need to have my testicles checked. They feel swollen.
Okay.
They feel heavy. So I noticed it 2 or 3 weeks ago during warm nights when I sleep naked. When I swing over, they sort of go clump,
Okay.
you know.
Yeah.
There's a slight pain at the root, as though being pulled.
2 or 3 weeks you've noticed this?
2 or 3 weeks ago, or just realising, you know, it's a warm night, but penis, as you know, gets very floppy, but it felt more floppy than usual.
You've also written on here low libido.
Yeah, I'm just turned 75. I've not had a sexual relationship for years, so if I do masturbate, it takes some time to get anything more than a...
Really? Okay. Yeah.
I mean, I've been giving it more attention because of this. So.
Yeah, no, of course then. Have a seat up on the couch.
What's your date of birth?
You're very welcome. Take them.
And the name?
Archie. Oh, I love that name, Archie. Hello. Could I have an appointment, please? I'm sorry, he probably doesn't sound anything like that. No, he doesn't. He's only born in 2003. Hello, it's Archie.
How are you getting on?
Since I last time saw you, I'm out of tablets for blood pressure.
When did you run out of tablets?
About a couple of weeks ago. I've been a bad boy for the last 2 weeks.
Yeah, well. So, and how are you feeling in yourself?
I think so. I'm feeling much better.
Are you?
I'm feeling much better.
How are the stresses? Do you remember last time you were going through a lot of stress?
Comes and goes, you know. I think it's my nature. I can't let go things quickly. I want everything perfect in my life, you know, especially in the business, you know.
Okay.
So if something is off a little bit, I get very uptight.
Right.
With my staff and all that.
Okay.
And lots of my friends have said to me, Ash, you need to chill out.
I mean, we had this chat before.
Yeah.
You're putting yourself at a very high risk.
Yeah.
I'm being serious because actually we're not talking about 10, 15 years down the line. If you carry on like this with these readings, blood pressure, with that lifestyle, heart attacks and strokes are a very real possibility for you.
Pinch your nose and blow. Keep blowing.
Keep going. Keep going. Keep going.
I had something that was similar to asthma.
I always have been suffering of coughing.
Are you bringing up any phlegm?
A what?
The muscles that line the passageways of the lungs, they tighten up.
We need to try and get the asthma under control because at the moment it's not ideal.
Oh, you are wheezy. Got a little orchestra going on in there.
How will your wife manage if you have a stroke?
Difficult. I've seen people with stroke, and I have an uncle had a stroke nearly three years now, and he's in a home care, and all his money, what he's earned, is going in, being looked after, can't move, can't talk.
Okay.
He's like a cabbage sort of thing. You know, I've seen a friend passing away, so I think...
So you've experienced it close up.
Experience, yeah.
And so I think we need to make some changes now, and I agree, and I would support you. We talked about work stress.
Work stress is the biggest problem, and then another one factor is my dad living with me, and it's getting a bit... I know he's 89 years old, it's my responsibility to look after him, but it's just getting sometimes a bit irritating, you know.
Okay.
Sometimes, you know, he makes a lot of mess in the kitchen, and when I see it, I said, what is this, Dad? Come on. Things I tell him, don't do it, just leave it there. He keeps on doing it and makes a mess. And that boils me up, you know.
I'm just wondering what might help you. What techniques could we try, or could you try, to stop yourself getting to the stage where you just boil over suddenly, going from nothing? You're not going to be able to change him.
No, there's no way I can change him, you know.
But we might be able to focus on how you change how things affect you.
Yeah, okay.
Because I think that's where we could start.
Okay.
You can't change him, but how do we change the impact on you?
Okay, all right.
So you're in the same situation, but you approach it differently.
Okay.
I mean, there are other options. We have other options. If you're getting very stressed with this issue, you know, we can always think about a few sessions of counselling where you can just explore this with somebody who's not related to your family, and you can really work through what options you have.
Okay.
And I think we need to do this together. So what tablets do you need today?
I need the everything.
And then can you have a think over the next 2 weeks,
okay,
between now and when we touch base, what else might help you to manage the stresses?
Okay.
You know, just have an ideal world. What would help you? What do you need to do? What do we need to focus on? We'll do the blood pressure, but what else might help you to focus on the stress?
Okay. All right.
Yeah?
Okay. All right.
Between us, I think we can then get there, because otherwise, all of the stuff I do is not going to be worth it if you're going to go off.
I understand that.
do
It's
that.
not. It works both ways.
Yeah. So if we're happy to do that.
Yeah.
Hello, Putney Mead, how can I help? Do you want to go and take a seat on the first floor?
Mr. Ackerman.
Doctor, how are you?
Fine, thank you. Nice to see you.
Nice to see you.
Right. What can we do for you?
I've had an operation on my ear. He had to rebuild my eardrum.
Okay.
Completely. When I came out of hospital, it was brilliant. I was jumping up and down. I could hear with both ears. But I had an infection, and ever since then, it's been driving me insane. Doctor, I am having a hell of horrible time. And I get the most throbbing headache, the mother of all headaches, I kid you not. And it hurts. It really feels...
Is there pain in the ear?
Yeah, everywhere. I get it all over. All over. It makes like a bubble noise. Brr, brr. Do you know what I mean? It's driving me absolutely insane. I wish to God I'd never had the operation. I really do.
Right.
Now, the past couple of weeks, I've been losing my balance.
Right.
Nearly fell a couple of times. I'm a chef, you see. And I'll be honest with you, Dr. King, I'm very, very worried, because I use twin fryers and the temperature is 190 degrees. And if I fall head first into one of them, it might as well serve me on a fish and chips as well, or whatever.
I'm just feeling for any lumps in your groin there. Okay. So I'm just going to check your penis as well as your testicles. All right. And where's this pulling discomfort that you get?
It's really at the root.
So I'll just examine your testicles, okay? Good, that's fine. Would you mind if I examined your prostate?
Yeah, what does that mean? Put your
So
finger on my bum.
Yeah,
Yes.
that's right. Is that okay?
Yeah.
So the way to do it is roll over and face the wall.
Yeah.
And well done. Deep breath. Oh, that's it. That's fine. Why don't you pull up your trousers and come and have a seat, and we'll talk it all through. Let's have a look. That was in the past. Okay. Your testicles, from my point of view, feel normal.
Right.
And your prostate felt fine. Slightly enlarged, but a normal shape. And what's reassuring is
they feel normal.
They do, exactly. With testicular cancer, if it's causing a heaviness to the testicles, they do feel remarkably different actually from normal. They really feel very heavy from our point of view. So the fact that yours don't feel like that and they're a normal shape, no extra lumps, is very reassuring. In terms of the erection change and the low libido, it might be worth checking your prostate blood test, but also your testosterone. just to make sure there's no sign that either one of those is abnormal, just as a so that we're covering all the bases, really. Okay?
Yep.
All right.
Thank you very much.
Not at all. Nice to see you.
Stop me if it's sore when I'm doing this, okay?
Right.
It's still wet and red. And
Sorry?
It's still wet.
And red.
And red, and
Very red.
there's exudate covering it. We'll take a swab, but we also need to do something as well. We can't just leave it like that. Let me just touch this on the inside. Sorry if this is a little bit sore. Sorry. Sorry. Okay, all done.
Did you see a small little hole in there still, no?
I can't see the eardrum. It would be better to have you seen by the surgeon that did the operation, but it's not a complicated problem. It needs to be looked at, and it needs investigation. So I think that is probably the way to go. That we can get you seen in that clinic.
Can you give me tablets for it or anything to?
We can give you some tablet antibiotics.
Yeah, that'd be nice if I can hit it with that. So I'm amoxicillin, yeah? We'll hit it with that.
We'll try.
Yeah, no worries, Doc. You
No
guys
problem.
do a great job, so, you know.
All right.
Thank you for your time.
No problem.
Lovely to meet you.
And you. Wrong way.
Wow.
That way.
Do you know what wins a discounted now? Do you know why? I think it's the chemist. Hello. Hi, can I pick up a prescription, please? Hello. Hello.
Hello. How are you doing?
Oh, well, not doing very well at all. Really, I'm getting out of breath. It's all seemed to have happened in the last month, really.
Just getting worse.
I'm not sleeping well. And in fact, Saturday night, I just couldn't breathe.
Have you seen the surgeons yet?
Well, they said my ventricle in the heart, sorry, was closing up slowly, and that was why they said I should go see about having something put in to widen it up again. And I assume that's causing all the shortness of breath suddenly, is it?
Yeah. Well, if they do surgery, they will probably try to do it as minimally invasive as possible. So they might do it by going in via the wrist or via the groin and trying to open up the valve that way.
Yeah. I mean, if I was going to go, fine.
Yeah.
But if I'm going to find I'm worse off,
Yeah.
you know,
There are some risks of people having a stroke and things like that during this type of procedure.
yes.
The worst case would be that you didn't make it through.
Yeah.
But I think if you do nothing, I think your symptoms are steadily becoming quite a lot worse, aren't they?
I felt I needed to make him aware that, you know, his illness is a life-threatening condition, and the natural process of that condition will be that he will steadily deteriorate and eventually die, albeit in an unpredictable time frame.
What do you think? If I didn't have it done, probably what? I've got about a year?
I think that's notoriously such a difficult thing to be able to predict, I think.
Yeah. I mean, my main thing is not so much going, but I don't want to find I'm going to spend months almost like a vegetable.
Doctors most certainly should not always intervene to save a patient's life through treatment. It completely depends on the individual situation and the individual patient, of course. In medicine, we always try to do good and not do harm. And so in some cases, intervention can cause more harm than good. And if they choose to decline a treatment, then you have to respect their wishes and respect that that's their choice.
I think we just need to really await this appointment with the cardiothoracic surgeon.
Yeah, and if anything, obviously, it suddenly gets worse, I suppose.
If if things become, very critical and that overnight, then, 111, or if you feel it's a real dire emergency, then 999.
Yeah.
Okay.
Yes. Okay. Yeah, nothing I can do about it, is there?
When the time comes, whether I will have intervention or not. I think it is it very much depends on the situation, and I think until that time comes, I can't probably easily predict my decision, but within reason, I'm sure I would mostly want something done, if at all possible.
All right.
Okay. Thanks for your help.
You're welcome. Take care.
What can we do for you?
Okay, very simple. I have a hemorrhoid, and it's excruciatingly painful. Yes. Yesterday had some spots of blood on toilet tissue.
Okay, you've had these before, presumably, or
many years ago.
Right.
Yeah.
And you're fit and well otherwise?
Yes.
Should we have a look?
You can. Yeah, I've had a shower.
Fine.
I'm going to Italy next week, and I just thought, please go.
Yeah.
Just go before I go to Italy.
Oh yeah, okay. I'm just going to... Just tell me to stop if it's too tender. I'm just going to put a finger inside. There's a nasty pick. It doesn't actually look like it's thrombosed yet, which is what happens sometimes.
Right.
When they get sort of clotted and then they become sort of almost permanent. Right, you get yourself dressed up and decide what to do. Now, when are you going away?
Tuesday.
There is a sort of rapid access, or sort of piles clinic, if for want of a better word, that runs at St George's, but it's on a Thursday, as far as I remember.
I'll be gone.
You'll be gone?
Yeah. Yeah, I'm going to, we're going to southern Italy, Bari. Do you know it?
I don't know. Sounds nice then.
And whilst we're there, I'm proposing. So, we shall see.
So you really want these under control, don't you? Is it all planned then? Have you got a...
Yeah, bought the ring. I thought I'd just go for a nice stroll across the beach and then just go down on one knee as the sun's coming down, and if it all goes well. And if it doesn't, she's going in the sea.
Okay, so I think the thing to do really at this point is to treat it as much as you can.
Okay.
Now, it's on the sort of anal verge, so it's partly in, partly out, and as far as I can examine, there was a suggestion of some little ones slightly higher up as well.
Right.
So what I will give you is some suppositories.
Yep.
And some ointment as well.
Okay. So what do I do with the suppositories? Just push them off? Delightful. Right, okay.
All right.
Yep, thank
well,
you.
I hope it settles down.
Okay,
all right.
wonderful. Okay.
Bye now.
Have a good day.
And you.
There was this
Can't be
woman
bothered.
came in and she wanted to register her unborn child. And I was like, well, if it's not actually like on the earth yet, I can't like register it. And I was like, wait till it comes, you know?
Come in. Come and have a seat. Okay. So you've had a rough few days, haven't you?
Yeah.
What does the pain feel like to you?
As if I've been beaten.
Really?
What about when you lay down? You can't lay down.
I can't
because
lay
of the
down on
pain.
my back. I can't put my back down.
Do you want to take your jacket off?
Yeah.
And if I press... Oh,
yeah.
It's sore, isn't it? Oh, it's sore all along there, isn't it?
Oh, yeah, it's bad.
Goodness me. Do you want to lie down? You can show me where it hurts. Might be useful. Because obviously we know you've got osteoporosis and your back is curved. I mean, sometimes you can get little fractures in the spine. Where's that hurting you?
Oh, right across there. Oh, you see.
Let me know if I hurt you.
Ow.
You won't enjoy this too much.
Oh, sorry.
Oh, that's dear me, dear me.
I had the constant pain in this area.
The pain goes from side to side.
Oh, blimey. I feel so ill.
Oof. It's a cyst. I won't do any more.
Pain is bad. I'm in a lot of pain.
I can see that.
Oh.
Where's that sore?
All across there. See, I've only got to move. I can't go on my back.
No.
Because of it, but it's hurting across
of
here.
the pain at the front.
Yeah.
It's difficult for me to sleep in and everything. Oh. then it's agony.
There's obviously pain in the chest there, which looks like it's coming from the muscles and the bones rather than coming from the lungs. Well, it's difficult to know. I mean, you can get an inflammation of the cartilages there called costochondritis. It's like an inflammation of the costal cartilages, basically. Come on, you sit up, make yourself comfy.
See, I haven't got any movement like that. I'm in agony all the time. I went to the hospital, but I mean, they weren't particularly bothered.
They were bothered, Mum. That's why they gave you the painkillers and the antibiotics.
But you've no idea the pain I'm in.
We do.
I can see.
It's all so depressing. Oh, see, it's only that I sort of pulled myself up then.
And it gets you. There is always the possibility of, Queen Mary's Hospital has Bryson White ward, which is like a rehabilitation type ward. If we're finding it difficult to manage the pain at home, I mean.
What about calling it respite?
I mean, is it something that you would consider?
Don't know.
You're in pain, Mum.
I don't want to go in hospital.
But it's not like going into an acute hospital. It's it's like it's more of like a rehabilitation type unit. Mrs. Emanuel I've known for a long time, and she is a fiercely independent lady. She always comes in looking immaculately dressed. Her house is immaculate, and I think she's very proud of that and wants to be at home for as long as possible. But things had really come to a crisis point because, unfortunately, she's recently been diagnosed with Alzheimer's disease, and we weren't sure whether she was remembering to take her painkillers. I guess the benefit of going somewhere like Bryson White would be that we could hopefully get you better quicker.
Yes.
Should I make some enquiries anyway?
Make some inquiries.
Yeah?
I don't really want to. I want to stay in my own home.
But, Mum, you need assistance. You do need some help. At the moment, you need some help.
I mean, I think if I was in Mrs. Emanuel's position, I, like her, would probably be the same. I mean, no one wants to lose their sense of independence and autonomy, and to feel that other people are making decisions for you. I'm not saying it's going to be forever.
No, not.
So leave it with me. Am I able to get you on the phone later, John?
Yes,
Yeah.
you've got my number.
Yeah, I've got your number. All right. All right, do you want a hand?
Any movement?
Got it. There we go. Okay. See you later. Okay, see you later. I'm really proud to be part of the NHS. It's the largest publicly funded health service in the world. And it means that everybody, regardless of wealth and income, has access to good health care.
Gracias.
Thank you. Bye. Bye.
People often ask me, well, what is it to be British? And I think the NHS is a fundamental part of what it is to be British, and something that I'm very proud of, and I think we should all be proud of.
Does anything particularly seem to trigger it? I thought maybe Pinot Grigio would be a trigger, because every time I seemed to drink that, I would get a headache afterwards.
Can you put your hands behind your back as though you're doing your bra?
I can't put my bra that way.
That gun,
Yeah.
will it increase my CO2 emission?
No.
I buy some, what they call Dr. Chicken nuggets. I eat, like, say, 30 of them in one go.
That's quite a lot.
It's making me anxious. I'm a nervous wreck. I just can't stay there.
Why not?
I feel vulnerable. The house has been broken into before.
I started having a panic attack and thought, oh my God, maybe I've got like ovarian cancer. Because it really hurt.
I mean, that's the most terrible bruising I've ever seen.
Well, I might have knocked it because I don't notice, you see, because I'm so used to bruising.
Good morning, Nana speaking. How can I help?
Hello, hi. And what's brought you in today?
I've got a bit of a sore throat. I've had flu for about 10 days. And I'm going on holiday tomorrow. So the last time I went on holiday and then I had a niggle. It turned out to be something really big. So I just wanted to get it checked out.
Okay. It certainly sounds like laryngitis, that loss of voice.
Yeah, I've been able to talk a bit more today, but I completely lost my voice since Saturday.
Okay.
It really just doesn't feel like it's getting better.
Unfortunately, so the things like the laryngitis is typically more with a sort of loss of voice. It tends to be caused by viral things as opposed to bacterial, and not something that gets better with any medication. But we'll certainly have a look and see whether or not we should go down the route of anything.
No, it's fine. I just wanted to check it out.
Okay. 36.8, so that's nice and normal. If you open up nice and wide, it's not terribly exciting at the back. So the tonsils aren't huge. There's not loads of pus or anything along those lines. And if you took your head forwards, where are you going? Are you going somewhere nice? Or...
Going to Lisbon for a hen weekend.
Okay. Yeah. Hen weekend like this? No.
I organised it, otherwise I wouldn't go.
Not the best combination, unfortunately. Stand up and let's have a listen on your back. If you, is this a dress or?
Yeah, it's a dress.
Well, we can probably listen from the top if you slip your cardi off. Okay, perfect.
Yeah.
And some breaths in and out through the mouth. Yeah, chest is clear as a bell. So what happened last time? What were you worried about from the last time where it was sort of...
I just had a sore tooth, but by the time I got there, it turned into like a wisdom tooth. And I just went, oh, nothing was open because it was Easter.
Yeah.
I just spent the whole time in agony.
Yeah, you're doing exactly the right thing at the moment, which is resting the voice and not shouting at anybody, limiting your alcohol intake in this hen weekend.
When you say limiting,
well,
realistically.
Do as you feel is right.
Okay. Is there anything else I can do?
Things, sort of sometimes, from a pain point of view, gargling aspirin is the best option.
Okay.
But other than that, there's nothing. It is just resting the voice and time. If you go to either NHS Choices or patient.co.uk websites, there's loads of advice on there. And if you just put in laryngitis, which is what this is, and it is just time, it's really the key.
With the flu that I've had?
Probably just incidental. Your immune system was probably knocked with the flu, and then you developed this infection.
All right, thank you
so,
very much.
Yeah, enjoy this hen weekend.
I'm going to make some signs.
Well, you need, sort of a standard set of signs and go from there. Take care. Take care. Bye then.
What's your date of birth, please? Oh, happy birthday!
Come and have a seat. I'm Dr. Beecraft. Sorry to keep you waiting.
Don't worry at all.
Right, what are we up to this morning?
Okay, so basically, I suffer from migraines.
Okay.
And I have been since I was probably about sort of 16, but very, very rarely.
Okay.
Just recently, I get them all the time.
Okay.
And there's not a point where I pretty much don't have one. Like last night, I went to sleep and woke up at like 2 hours later, and I had one. Okay. I was just like, and I've tried everything that I can possibly get just over the counter. but nothing just seems to work anymore, and I feel it's affecting like my work.
Okay.
And I've just started an internship, and I've been off now because obviously it affects my vision and makes me feel sick. I get them like over my eyes, and they're like a throbbing sort of sensation, and they're just getting really bad and really frequent.
So how long has it been getting worse for?
Probably about the last 3-4 months.
And do you get some kind of visual change with it as well?
My vision doesn't go, but it does become quite blurred and light. It's really like I'm literally like looking at my computer screen like dimming it down.
Okay. And will you be sick at all with it?
I have done in the past.
And how long does it tend to last for?
Good 2 days, if not 3 sometimes.
Yeah. Does anything particularly seem to trigger it?
I thought maybe Pinot Grigio would be a trigger, because every time I seemed to drink that, I would get a headache afterwards. Not that I was like drinking lots of it, like a hangover, but even just a glass. So I've cut that out completely, and I don't drink that anymore. I was watching a documentary, and apparently there was a young girl who went to the doctors about migraine, and it turned out like they were like, oh, it's fine, like blah, blah, blah. And it turned out that she had a tumour and she actually died from it.
When I talked through Abby's symptoms with her, the nature of the headaches that she was getting didn't sound anything like a cancer-related headache. The symptoms were completely different and really did just fit with a migraine. Statistics show that everybody has about a 1 in 2 chance of developing a form of cancer at some point in their life. And for that reason, there's huge amounts of attention brought to that in the media. People will have read stuff and be more aware of stuff, which is a good thing, but actually may not always have the right diagnosis. So what I want to do is have a little look at the back of your eyes. I'm just going to turn the light out.
Yeah.
Okay, sorry, it's not very nice. Fine, that all looks nice and normal. So what I would like to do is try you with something slightly different. What I would suggest is I'm going to give you a medication that as soon as you get that feeling that it's coming on, that you take one then. And what I'd like you to do is keep a headache diary for me. So to make a little track of when you're getting them.
Yeah.
Out of 10, how bad it is compared with normal.
Thank you so much for your help.
No problem. Let's hope it helps.
Yeah, thank you so much.
Okay. All right, have a good day.
You.
Bye.
You too.
So come in tomorrow at 12 and then I'll help you with your registration, okay?
Hello.
Dr. Shah, hello.
How are you?
Well, about 5 weeks ago, I was staying with my daughter down in Somerset. I got sunburned on my forehead. Well, it's now spread all over my face and my arms. The skin.
Quite dramatic, isn't it?
Yes.
Much, much worse than that. You must take off your jacket. I'm going to fill you in as to what occurred.
So 5 weeks ago it started?
That was the start of it, yes.
But this terrible pain that he's had on the shoulder. Now you'll have to just look at this bruising.
Oh, wow.
So tell me what happened.
Well, I was on a mountain bike and I fell sideways, put my hand out, and I still can't really bend it.
I slipped backwards as I was getting in the shower, elbows down, and smashed the decorative tiles.
Is it bended this way?
I don't think it's like broken, I think it's just like really sore, I guess, and then my head hurts a little bit.
And it wasn't that anything felt like it popped out or popped
No,
back
no
again?
popping. It was definitely a rip of some description.
Okay.
Hello, good afternoon. And come in, take a seat. And Miss Rita, what's brought you in today?
My arm, which I got a cricket ball on the 12th of July.
Okay.
So we only started up here, and then on Saturday it was down to there, and today it's gone from there to there.
Okay.
So I'm starting to get worried, thinking, what is it? What have I done?
You're using the arm fine, then?
Yeah, I'm using it. Like,
and you managed to ride your scooter here?
Left-handed on the scooter.
Using the right arm at all on that, or...?
Sometimes it was, sometimes it wasn't, because it's pain in there.
There's pain in and around this area here.
Yeah.
And if we just have a look at the elbow, it goes straight. That's good.
That up to there, it's hurting.
It's hurting in here.
Yeah.
Yeah. And the cricket ball hit you straight on here, did it?
I don't know where it hit me. I know I caught it, and that was the main thing.
Yeah. So you've got the catch.
Yeah.
Okay, fantastic. Is this causing any problems around here? No. Around the elbow? No. Okay. So I'm happy with everything bone-wise in here. What happens is when you've been struck by this ball around the muscle here, there's been a load of bleeding in and around the muscle.
Yeah.
Some of that blood's quite deep in the tissue.
Yeah.
And blood, even when we're getting a bruise, it's still fluid in the skin. It's still liquid.
Yeah.
And so what's happening, every night you go to sleep, that blood's, moving backwards in the skin and just coming out. And then you stand up all day, and then the blood slowly comes down in this direction. And so essentially the bruise, which was all in here, has just ended up around here. And with the fact that you're using the arm fine, I wouldn't do anything else. And it will settle down over the next couple of weeks. But nothing else we need to do at the moment.
Okay.
You okay?
As I said, that's what I was main concern, just to get it
What's it
out.
getting up to?
Yeah.
Exactly. Well, you can be relaxed.
Cheers.
Okay, take care. Have a good evening.
I mean, that's the most terrible bruising I've ever seen.
And no other reason?
No. I don't remember.
No falling,
I mean,
no injury,
I
no
occasionally
knocking.
bang myself and don't notice, but I'm used to the fact that I bruise very easily.
Yes. A blood vessel must have been injured at some point somewhere. And that obviously normally happens from knocking it.
Right. Well, I might have knocked it because I don't notice, you see, because I'm so used to bruising that if I just bang against
No, but it's never been like that before.
No,
it would have to be quite a big knock. So if
You
it's
would have
not
noticed
that, then it could have been one of your superficial veins here might have by itself just popped.
Right.
And then just in your case, it's just made a much bigger bleed come up here. So I think that's probably the more likely thing, because you would have felt the pain of knocking it to cause this.
But that's the shoulder, but this is, at the moment, the worst thing is...
The redness. Yeah, that skin is just irritated so badly.
Yes.
Is that psoriasis?
No, it's not. This is the sun. This is a overreaction.
Really?
It's a photosensitivity reaction.
Really? Are you sure?
It can be because of different things. So it can be because the skin is made sensitive by something else.
Well, I do have a very sensitive skin, I know that.
So it's definitely not psoriasis?
No. Psoriasis comes in patches. The thing we want to turn this reaction off is a steroid cream. And in your case, we might need two. One for the arms.
Yes.
Anything below your neck is going to be a stronger one, and on your scalp and your face will be a milder one.
Right.
And what about the swelling on his hands?
This is linked in with this sun reaction rash.
I'm absolutely
It can be
amazed
dramatic.
at that.
It can be dramatic.
So really, he must never, ever go in the sun.
Ever again.
What you must do is, if you go in the sun, you must wear factor 50 on the areas that are exposed to
So
sun.
no more trips to
and a hat.
Ibiza.
No more trips to Ibiza.
Thank you for being so thorough.
No problem.
Anyway, lovely to see you, Dr. Shaw.
Thank you very much indeed.
Bye-bye. See you.
My belly's just bloating. Should I just stop eating wheat? No, I'm gonna bring in my what's that tea?
Green tea.
Yeah.
I don't really know what's wrong with me, but essentially, I live quite a healthy lifestyle. Like, go to the gym like 4 times a week, eat really healthily. Like, I don't eat any overly refined carbohydrates or anything like that. Super healthy. However, in the past month, recently, every single time I eat, it literally looks a little bit like I'm 3 months pregnant. Okay. Every single time, even if I'm only having like a bowl of soup, just blows straight up and it feels really tender.
Okay.
And it's getting to the point it's just so uncomfortable. And at night, I literally cannot sleep because it hurts so much.
Yeah. And do you get any kind of tummy cramps at all?
Yes. So, accidentally had pasta last week. And literally I was sat there at work and I just couldn't do anything. You know when you're just all cramped up? It just really, really hurt.
And what about your bowels? Regular?
Yeah.
Not hard, not too
No,
soft?
like clockwork.
Okay. Is your weight stable? Or are you losing weight?
So I
without
think my
trying?
weight's stable, but when I saw my parents last weekend, my mum kept telling me how fat I looked. But I don't know if that was only because I was so bloated.
Oh, okay. Does anything run in the family at all? Any bowel problems, celiac disease?
So my mum's got IBS.
Okay.
This is my biggest concern because I feel like it's being passed down now. Apart from that, no. My grandma's diabetic and I think that's it.
Okay, fine. Can I just examine your tummy? You have a lie down on there. Are you okay just to lift that up?
So that's where it hurts there.
Saw there.
Yeah.
Okay. And here.
No, not so much there. It's more at the sides there.
Fine. A little bit tender here, isn't it?
Yeah.
I'll let you come down. Would you eat some sort of wheat every day? So some sort of bread, pasta, biscuits?
No, it's not too much wheat, but that's only because I've consciously cut it out in the past month.
I don't think there's anything serious going on.
Good.
So that's good.
I started having a panic attack and thought, oh my God, maybe I've got like ovarian cancer.
Oh,
because
gosh.
it really hurt.
I think your symptoms, a little bit like irritable bowel, what you're
Yeah.
describing. Often people with irritable bowel tend to have some sort of bowel upset, so
Yeah.
either diarrhea or constipation. You don't tend to have that.
No, no.
So it's more kind of just the bloating and
Yeah.
things. So we'd always just suggest some blood tests, and that's really, we're doing those blood tests to make sure that you don't have anything more sinister going on.
Okay, then, yeah.
Okay. The other thing is that we're finding that certain foods are particularly bad for bloating.
As I
and
said,
sometimes
so-
it's very healthy food.
Yeah.
So people come and say, I eat a healthy lifestyle.
Yeah, that's
but it's,
exactly what I was confused.
You know,
So
things that can cause bloating are apples and pears and artichokes and beetroot.
absolutely loads of those.
I'm not quite sure why there seems to be an increase in people complaining of food intolerances. For some patients, avoiding certain foods can improve bloating. Limiting fruit juice to 1 glass per day. Also avoiding some foods that produce gas, such as Brussels sprouts, broccoli, sweeteners, cabbage. Some people find that lactose, which is mainly found in dairy products, can also cause bloating.
That's perfect. Thank
I
you
think.
so much. Really appreciate it. I just hope it gets better.
Yeah, it should do. It does
Stay looking
tend to
like
be
5 months pregnant everywhere I go because I'm so little as well. It just
Yes,
looks absolutely
yeah.
ridiculous. That's
Okay.
great. Thank you
All
so
right.
much.
Pleasure.
Thank you.
Okay.
Hello, could you please give the surgery a call regarding your appointment this evening and speak to reception?
I don't speak to you.
I'm fine. What can I do?
asking that, should I? You should be asking me.
What can I do for you?
I'm actually need a favour. I've recently swapped into a ground floor flat.
Yeah.
And you know I've been suffering from depression and the noise upstairs is horrendous. So I've been trying to get housing to move me to a different property because they've got creaking floorboards, I don't sleep. I'm lucky if I'm getting like 2 or 3 hours of sleep a night and I'm jumping up in the middle of the night with the noise because they're dropping stuff on the floor. Housing said the only way that I could possibly get a move quicker is if I get a medical note.
And have you tried earplugs?
Yes.
And they don't help?
No.
Why not?
They just, I feel a bit vulnerable having those in, and I don't see why I should walk around my house with earplugs on all the time.
Okay, fair enough. There are GPs who really find this is very frustrating because people are coming in, they've been pushed to see their GP for a letter that's not primarily a medical issue, and it's just a way of whoever it is who told them to go and see the GP to get them out of the room.
I mean, the noise is absolutely horrendous. They've got no carpet, and the floorboard is a very old house. It's constantly creaking, and the people that live there are on shift work.
It actually saved me time to do it there and then, and I did have the time because I wasn't running late. It was quite appropriate for her because she has had problems with depression and anxiety, and it was obvious this was really upsetting her and that she needed the backup of a letter, and she'd be really distressed if she didn't get it.
It's making me anxious. I'm a nervous wreck because every time things drop on the floor, I'm jumping up in the middle of the night. I just can't stay there. And, a lot of times I've been staying at friends' houses because I can't stand it.
So are you saying actually, apart from anything else, you're worried you wouldn't want to use earplugs because you wouldn't...
Well, I feel vulnerable. The house has been broken into
Right,
before.
okay. It's night time, really.
It's actually between 12 o'clock and 5 in the morning. And I'm a carer now for a friend who's got Alzheimer's, so it's quite difficult for me. I'm also considering going to the MP as well to see if they can move me a bit quicker.
If you want to speed up the process, I'd go to your local counsellor. I think that probably they are more likely to be helpful with housing.
Yeah, that's brilliant. Oh, thank you so much.
Okay.
Thank you. Hopefully it will resolve everything and I'll feel a lot better. Thank you for your help.
Okay, bye.
So my next appointment with the doctor is Friday. Do you feel able to wait till then?
OK, so I've booked you in 4:30 with Dr Laird.
Right then. We had spoken last time about these stomach pains that you've had for years and years.
Yeah.
Your mum used to drink lots of Gaviscon.
Yeah.
You used lots of Gaviscon. You, at one point, had a peptic ulcer.
Yeah.
You said that on the tablets I gave you, the stomach pains got better, but you still get them.
Yeah. Now, it's whether it's to do with the tablets, I don't know. It's whether I might have eaten something or eaten too much and the pain don't initially come around and then all of a sudden it appears. It could be that, I don't know. But sometimes they're excruciating, if that's the word.
Where in your tummy do you feel it?
But round this way.
In the middle?
Mostly, yeah, mostly. But sometimes it's been to the sides, you know. It just depends, I don't know. They just come and go. I can eat a horse and feel all right. I can eat half an horse.
Do you get any other stomach symptoms? Burping, bloating, reflux, swallowing problems?
I have trouble sort of yawning sometimes because as I try to yawn, it's lifting this pain up a bit further.
Yeah.
Then I've got to wait for a gap. I wait for an opening to yawn. I think, right, now there's a gap here, I will go through it. So, you know, then I'm sort of like...
Having a good yawn?
I'm having a very good yawn. Like, I'm making up for like the last 4 in one go.
Okay.
You know, with the last 4 average yawns. I've had 5 yawns in one. That's the way of putting it.
I think you've explained that very clearly, which is good.
I'm not a big meat eater. If I've left to my own devices, I would tend to eat a lot of beanie type things.
Okay. I tried a very tentative with egg.
Yeah.
And she had a rash, but mainly around her mouth, and she also would vomit.
I don't eat any butter at all, apart from on toast, which is about once a week. I do eat cheese, but not tons of it. I stopped eating bacon because of this.
Do you like your milk more than your food at the moment, young man? Is that the problem?
So you thought you had put on weight, so you stopped eating potatoes.
Yeah, and just stopped eating a lot of potatoes and starch was not the thing to do. You know?
Oh, right, OK.
But I possibly went too far down that road.
And we'd spoken before about the fact that your diet was quite restricted.
Well, yeah, I very seldom eat cooked foods. You know,
it's mostly
or even
cereal.
Microwave. Yeah, it's mostly cereal. Although, just recently I bought a couple of ready meals and I buy some what they call chicken nuggets. I eat like say 30 of them in one go.
That's quite a lot.
Yeah, but they're only like that. It's like eating I don't know, like I mean if it was like 30 gobstoppers.
When you've eaten 30 of these things. When you eat 30 of these chicken nugget things, does that give you this stomach pain?
No.
Okay. Thinking about all these things, you've never had any bleeding, you've not got any swallowing problems, and your weight has been extremely stable. So that's good.
Yeah. You know, so I don't eat a lot. Oh, I drink now and again. I'll eat the beer quite a bit, but...
What's quite a bit? Because whenever I've asked you about alcohol in the past, you've said that it's very unpredictable. So if you've got some money, you might buy some cans And
Well,
then
yeah,
drink.
the cans are ongoing, right? But the thing is, going out for a session is basically once every week.
How many beers will you have on the day that you get paid?
Oh, Christ. I don't know how many I've had. I don't count them.
So you might have 10 pints that day,
no,
15 pints?
I'd go more than 10, but I wouldn't say... I couldn't give you an exact figure after 10.
Does that make your stomach pain really bad?
No.
Okay.
I don't think it does anyway. I've never actually occurred, it's never occurred to me that could be it, but might well be.
Let's draw this to a close. I guess the question that's been going through my mind is, do we need to send you back to the stomach doctors, given that you've got ongoing, sometimes very severe stomach pain that hasn't gone away with the tablets I've given you, and we don't know what the cause is?
Right.
What's your feeling about that?
I don't mind.
I think you need one more blood count, because your last one was ever so slightly low, and it changes the decision if it looks like your blood count is dropping.
Right.
So have your bloods done. Right. Come and see me in 3 weeks' time.
I should have the blood test in 3 weeks' time.
Good to see you.
Yeah, and you.
Take it easy.
Yeah. Right, we'll find your way out again.
Yes. Left at the end.
The lungs seem to be working, don't they?
Hiya, I've just lost Lily. I think she might have gone to the toilet.
Oh, okay.
So she said, fine. I haven't looked because she's just been taking her weight and all preparing stuff.
Hi, Mike. My name's Sean.
I thought I've lost you forever.
Oh, Rhoda.
I broke my leg. No, that's
right.
People. Okay, Lily, sit down nice and quietly. School and nurse noticed the differences in Lily.
Okay.
And they sent me to see you about her nosebleeds.
Right.
They're very violent and very often.
Oh, honey, just be careful there, because I don't want you to go too high and then fall off, OK? Let's bring you back down a little bit.
She's a very active little girl.
OK, and nosebleeds, how often does she get those?
She had one yesterday. It wasn't that bad. How often? It's not regular, but...
Like once a week, or...?
It would be like a couple of times a week, and then it will stop for a week or two.
Yeah.
There was a month break, but when they come in a serious. Like, there's more of them.
Can I have a little look in your nose? Is that OK? Yeah? So, what's the longest without a nosebleed? A few weeks?
A month.
A month, maybe?
It was, I think, a month.
And when she's having a run, how often does she get them? Every day, or...?
It will be every day and a couple of times a day.
And what do you do when she gets a nosebleed?
What we do is, I've researched to hold the tip of the nose.
Absolutely, yeah, that's right.
Do not lie her down.
How long does it take to stop bleeding?
10 minutes, that's the minimum. They're very violent. There's lots of blood coming, sudden, like boom, and a big rush.
There is a peak in the incidence of nosebleeds from the ages of 2 to 10, and then in the older age range of 50 to 80.
Just relax your nose. Don't scrunch it. Relax.
Is it gonna hurt?
No, it's not gonna hurt.
I wasn't 100% sure on what was causing Lily's nosebleeds. It might be because there is prominent vessels in that part of the nose. Also, there was some crusting to the nose, and certainly an infection can cause nosebleeds, and it's always worthwhile treating.
What we're going to do is I'm going to give your mum some special cream that I want you to put on the inside of her nose, OK? 4 times a day for 10 days.
10 days?
Hopefully that will stop the nosebleeds.
Be sad. 94649.
Wow. We're happy. All right, there we go.
Lila, you've got to stop. You've got to stop now.
All right.
Thank you very much.
Bye-bye.
If you feel he needs to be seen, I can ask the on-call doctor to call you.
No, you're full of stress.
Wouldn't you be stressed? Can you put yourself in my situation?
No. I know.
Instead of ganging up on me.
We don't gang up on you.
You did.
We just want to help you.
Even
Take
Chelsea,
this-
Chelsea Blanc.
Take the stress off.
Come in.
Pleased to meet you, mate.
Hello. Please do all have a seat.
I'm from Australia.
Are you?
I'm over for about 3 months.
Great.
Recently retired from work.
Oh, congratulations.
Well, I've done my bit.
Yeah. What job did you do?
I work for council in Sydney.
In Australia?
In Sydney.
But you're from the UK originally?
Sheffield.
Sheffield.
Yeah, you can't take it away, can you?
You can't. What can we do for you
Well,
today?
what happened is me looking after myself since I've retired. Go to the gym 3 times a week.
Yeah.
Swim, do my 30 laps after half an hour in the gym.
Well done.
Yeah, exactly. I'm feeling good. Lost a bit of weight. Looking after myself.
Brilliant.
Started getting floaters and flashes.
Oh dear.
Exactly. So straight away I went to Sydney Eye Hospital.
Well done.
There's no detachment, but he says it's important that you have a follow-up in 6 to 8 weeks.
So we've got to try and arrange a way for you to see an eye doctor
That's right.
to have another examination.
That's right.
There we are. Well, we can sort
Slot in
that
around
out.
about 6 weeks.
I can sort that out for you.
I've not slept for 2 days, so I think that can probably affect this. I don't know. Can they cure floaters?
No.
Kind of thing now. Instead of turning my head suddenly, I might get a little arc, like flash. But I've got a floater there now, but I'm kind of learning how to put up with this.
Yes. Floaters are shadows which are cast on the retina by debris which is inside the eyeball. The retina is the thin lining at the back of the eye which detects light. That's what you use to see. In most cases, floaters themselves don't need specific treatment. What I'd like you to do is, on the way out, if you hand this to reception so they can photocopy it,
That's fine.
and I'll send this off with the referral.
Yeah.
If we're not able to get that organised routinely, we can get you seen in the emergency eye clinic.
Oh, that's fantastic. Oh, that's good.
So that's easy to sort out.
Thank you for your service.
Nice to see you.
Much appreciated, and thank you very much.
I don't know what's causing it, but essentially my mouth is very sweet.
Very sweet.
Yeah, it tastes like I've always got sugar in my mouth.
I have to say it's a completely new one for me. I've never heard anyone say that before.
I couldn't feel anything here and here. It's like when I had anaesthetic.
Do you have swelling on your tongue as well, or just the mouth?
Not the tongue, just
No,
the
and
mouth.
your breathing was okay?
Well, okay.
Okay.
Every night this week, nothing, except for last night.
All right.
It started again last night. I thought, well, what's going on there?
Feels like something's going to pop out of my ear.
Okay, nice.
You have your tea, you're not drinking your tea.
Coffee it is.
Yes, coffee. I drink tea just like that.
Black.
Yes.
Right then.
I never had this before.
Right.
I went to bed Monday night.
Yes.
And when I wake up to spend a penny, my whole body was in pain. All my back just hurting. I was in a terrible state.
Oh gosh.
What do you think caused that?
Not sure. I need to ask you more about it, then we'll decide. So, do you have a headache?
Yesterday, I was having like a headache.
Right.
I don't have it today.
Where does it hurt today? Both knees,
Both knees and
elbows.
elbow. And when I do like that, when you do like that, I wanna.
What do you mean?
But when I breathe in, you could feel a pain around here and all that.
Right.
Mm.
Is your vision normal?
Yes, a vision. You know, sometimes I get the vision. Sometimes, like, the light, not this kind of light, like the bulb.
Yeah.
The bulb, like a zigzag, but it,
A halo.
what is it? No, halo is round.
Oh,
This is not a round. It's like a zigzag.
okay. So can I have a look at your shoulders, maybe?
Yeah.
Can you maybe
Take-
slip this
take
off?
this off.
Have you got a T-shirt on?
No, I don't really, I can't wear up clothes.
Okay.
Yeah.
So let's just check up here. Are you tender around here?
No, it's all right when you touch it.
That feels all right.
Yeah.
Fine. Let's just work around your shoulder joint, okay? Okay.
Yeah, just when you press
At the back?
right there, so right
Okay. Can you stand up for me? Okay.
there. Yeah.
Perhaps if you have a seat.
On the bed,
Yeah, just sit on the
Yeah.
edge for me.
like somebody was bashing me. Oh,
All right. Can you put both hands behind your head for me?
yeah.
Can you push your elbows back? Does that hurt?
A little, not much. A little.
Can you put your hands behind your back as though you're doing your bra?
I can't do my bra that way. I have to do it in the front and then turn it. Yeah.
So can you show me your knees? So which knee's worse?
This one.
And where does it hurt?
This, you see how this one's there?
Let me just work around your knee. Does it hurt on this
And your
side?
hand cool.
They are cold, aren't they?
Yeah. Oh, it's so cold. Feel my arm.
Oh yeah, your hands are much warmer.
Yeah. Yeah, you see.
Oh, you've got a little...
What? A cyst?
Yeah, a little bit. Can you bend your knee for me up and down?
I exercise it. I try and exercise it every day.
All right.
Why I wake up with this pain?
I'm Pa, the healthcare assistant here. Come for your blood test.
Oh my God.
Is this your natural hair or is this artificial hair?
Yeah, natural hair.
Sorry, it's squirted. It's definitely a cyst from the fact that it's squirting everywhere.
I've done blood tests quite a few times. It's quite difficult to
Really?
find out, yeah.
I like a challenge. Yeah, got it.
You can have the record for the most wax down your ear. Oh my God. Yeah.
Come through. All right, I'm Karen.
Thank you. All right.
Sit here for me.
Yeah,
Lovely.
exactly.
Okay, so you come to see me today about smoking, is that right?
Yeah.
You want to give up, do you?
Well, I'd like to. I'm 75. I've been smoking, just to fill you in, since 1954.
Right.
So it's going to be a long, hard job. I've cut it down to 4 a day.
So why all of a sudden you decide you're going to stop smoking?
Well, because I've had a bit of trouble in as much that I've started falling over.
Okay.
And I think that it's down to...
So you've never given up smoking before then?
No, no.
You ever tried the inhalator and the you know, the electronic cigarettes? No.
Well, the flavour is disgusting. It's not tobacco, that's for sure.
Well, no, it's not. That's the idea of it. You're addicted to the nicotine, but the thing that's killing you is the tobacco itself. So there's obviously things I can give you to help you to stop smoking, like patches. And obviously there's oral products as well you can use, chewing gum, lozenge.
That interests me, chewing gum.
Chewing gum, because you can't get rid of the last 4 cigarettes, I think you probably may need a small patch.
Well, probably, yeah.
You're going to give it a go?
Oh, certainly.
Okay, I'm just going to go get my machine to take a carbon monoxide reading. 1 minute.
Okay, yeah.
Paul, have you got your machine?
Yeah.
Could you do it for me? Yeah. Thank you, sorry. I've got my colleague with me because his machine's working
Hi.
and mine's not.
How are you?
So this is Mr. Durnsford.
So in a second, I'm going to get you to take a deep breath, like that, and hold it in. And then on the 3rd beep, you blow out through the tube slowly. Just release it like that. Okay, take a deep breath. Hold it in. Hold it. Hold it, hold it, hold it. And the 3rd beep. So now blow out slowly. Until you can't blow anymore. If you
That's
stop,
it.
that's fine.
Lovely, thank you. All right, that machine's telling us that your oxygen loss level is 2.4%. So that means your vital organs, liver, lungs, kidney, especially your heart, is working 2.5 times harder to keep you alive.
Oh, God.
It should be naught.
Should be.
Yeah, it should be naught. Yeah. So the plan of action will be I'm going to give you some low-dose patches. The patches are used 1 a day, and I'm also going to give you some chewing gum. You can have that as and when you need it.
That gum,
Yeah.
will it increase my CO2 emission?
No, it's going to release it. Because if you stop smoking, that's what the idea of this is about.
Oh, right.
If you'd like to come to the waiting room, I'll bring you the prescriptions to you. Come on, then.
Come and have a seat over here again.
What's your name?
Dr. Pierce.
Pierce.
Yeah.
Pierce. I used to work with a lady named Mrs. Pierce.
We have met before. I think you had a chest problem then.
Oh, when I have that, oh, God, sorry. Jesus.
Right. I'm not absolutely sure why you feel like this. I think that there are some things that we should rule out.
What, like what?
I want to rule out a problem called polymyalgia.
What is that?
It's a muscle inflammation problem.
Because somebody was saying to me I could be having inflammation.
Polymyalgia is a syndrome causing muscular pain and stiffness, which quite often comes on relatively suddenly and usually affects muscles in the upper body, around the shoulders. It can make people feel quite ill and tired. It more commonly affects women and only really affects people over the age of 50. So I think the way to do that is with a blood test today. Maybe we should see you again tomorrow with the results.
Tomorrow, Friday. So I have to come or kind of phone or so.
We could phone. I'll leave it on the list for somebody to look at the results tomorrow and ring you.
What time? Oh, they would ring me.
I'll ask them to ring you and tell you whether or not you need to start some steroid tablets.
No, God.
Whenever we talk about polymyalgia, we also give people the same advice. If you were to suddenly develop a very severe headache or have any funny changes in your vision, you need to tell us immediately.
Okay.
I don't think that'll happen, but we always say the same thing.
Yes. Well, it's nice of you to give me all these instructions. Doctor, you married?
I am married, yes.
You have children?
I do, yes.
How many?
I've only got one.
Only one. Oh, how old is she?
8 months.
Oh, it's a baby. A girl.
A girl.
What's her name?
Isabel.
Isabel. Oh, dear.
So, take these round to room 1.
Yeah, room 1. Hold this for me, please. I can get them. So when you get old, you know, all kind of things. You want to get old?
Not really.
Anyway, I'll see you and thank you.
All right.
Yeah. Bye.
Bye-bye.
Thank you. Thank you very much.
Pleasure. I hope you feel better soon.
Okay, thank you.
Okay, wonderful stuff. Take care. Thank you.
Nice to see you. Bye-bye.
Bye-bye.
Would you say thank you to the doctor?
You're welcome. Are you going to let your mum put the cream on so it gets better? You're welcome.
Brilliant.
All right.
Thank you very much for that.
Okay,
That's
nice to see you.
Nice to see you.
Bye-bye.
Thank you.
Bye, thank you.
Good morning, Horford Health Centre. Sally speaking.
My stomach swells up and then the blood just kind of gushes out at me.
I think I'd rather stay alive a little longer.
Yeah, we'd all like to stay alive a bit longer. Yeah.
Yes.
I had a bad relationship. I don't trust, to be honest, I don't trust in love.
It's like a burning sensation, like someone's put like a cigarette out in the middle of my ear canal.
Okay.
And I just don't know what it is. Feels like my eardrums or something's about to just explode or something.
We have to say this because you understand that obviously it's a potential squamous cell cancer.
Yeah.
cold.
Ugh, nasty. Good morning, Hofford Health Centre. How can I help?
Louise Horton. Hi, Louise. Hello there. Do come on. OK, do come in. All right, I'm Dr. Cordell.
Hello.
You normally see Dr. Lee, don't you? Is that right? Yeah.
Yes. Yeah. I have like really sore skin, just hair on my breast. It looks almost like it's really dry skin. I spoke to someone, like 111 or whatever it is, and they asked if it hurt, and I said, I don't know, because I have no feeling along there after my breast reduction.
OK.
And it's getting bigger, so I'm obviously just a little...
The area of soreness is getting
so I'm a
bigger.
little bit concerned.
Well, we should check it out, shouldn't we? I'll have a look, OK.
OK.
Do you want a nurse to come in while I have a look?
No.
No?
As
OK.
I said to the receptionist,
Pop
once
up
you've...
behind the curtain here, then.
Lovely.
You just remove what you need to remove.
OK.
To see the area. And you've not had rashes or sore patches there before?
No, I had a really bad infection after I had my breast reduction.
So, this is the patch?
Yes.
OK.
Hello, come and have a seat. I'm Dr. Barnard.
Hello.
Oh, thanks, Callum.
What can I help you with?
Callum has been going over on his ankles.
Yes.
Now, I thought it'd be something that would probably rectify itself, but last year his school shoes kind of kept on getting wrecked because his ankles were going over, so...
OK, yes.
His teacher at school, kind of at the end of the year, said, oh, I think you should get them checked out.
How long's it been a problem for?
You could start seeing it a couple of years ago, couldn't you?
Yeah, it's not something that you would jump up and look at him and go, oh, he's got really bad ankles.
So you're not sort of turning over on your ankle like you're currently twisting it or anything?
Not twisting, it's just literally a posture thing.
Well, I did twist it once and sprained it.
Yeah. And then I kind of noticed that actually everything's turning in a bit, and then he says he's getting pains in his legs, intermittent pains.
Yeah, I was going to ask you, getting any pains in your knees or anything?
Sometimes, yeah.
Yeah, OK. Do you want to pop your shoes and socks off then and we'll have a little look at your feet? OK, and stand up for me. And just go up onto tiptoes for me. Yeah, OK, and back down again. OK, and sit down again for me. It's got very flat feet, haven't you?
Yeah, I think.
Yeah. Does it run in the family at all?
Yeah, we've got hobbit feet.
Yeah.
Well, I've got hobbit feet. I just don't want it to affect him kind of with his running.
So it's really common, flat feet, especially in this age group. We've got quite flexible feet. And generally what you need is insoles in to give you that support to your arch so that you're holding. So you see, when you stand up, because your arch just collapses, your ankle rolls in.
Yeah.
Whereas if you've got the support in there, it comes up to a more natural position and then it's all straight again. So that's what you need. But it'd probably be orthotics at the hospital to make some insoles.
So will that, if he has insoles, do you think that will rectify itself, or...?
It doesn't sort of change the underlying foot, but it just puts the foot in a normal position.
Okay.
So people with really flat feet will find that they need to wear them all the time and they just put them into their shoes.
OK.
Yeah.
I say that wasn't too bad, was it?
No.
The skin feels a little bit thickened, doesn't it, actually?
And it started off as big as my fingernail, and it's then just got bigger.
It's got
I would
bigger.
say maybe
and
3 weeks.
Yeah, it's a bit bigger than a penny, isn't it?
Yeah.
Now, really, in size. And it's got this sort of little bit off the side. Looks a bit like Australia, doesn't it? Dress yourself up. We'll have a chat about what to do about that. OK. Sometimes we take pictures of these funny rashes when we're not sure what they are, but I'll remember yours because it looks so much like Australia.
Well, I've never been there, so it's nice for Australia to come to me.
Yeah, it is, isn't it? OK, come round when you're ready and we'll chat about that. OK. So, first question, is that anything serious or sinister? It doesn't look like it. So I think that's most likely some form of dermatitis, OK?
Oh, OK.
It could just be a type of fungal infection. That's the other possibility.
That sounds beautiful.
Yeah. And if it's not one of those two, we will get a specialist assessment. Now, I think actually we will treat you for a fungal infection first, because if we treat for dermatitis and we're wrong and it's a fungal infection, we can make it worse. So I'm going to give you 2 weeks of antifungal cream.
Okay.
Okay, to use. At the end of that 2 weeks, if it hasn't gone away, I'd like you to go on to a steroid cream, which is what we use for dermatitis. Okay, and do that for 2 weeks.
Okay.
Okay, if at the end of those 2 weeks it hasn't gone away, then we will get advice from a dermatologist, a skin specialist, okay?
Yeah.
Okay, if we're not winning, it is important that we go on and get a specialist opinion. So, okay?
Yes.
There we go.
Lovely, thank you. Handbag and cardigan. There we go.
You got everything? Very good.
Yes, sir. Thank you.
Okay. Bye-bye.
Bye.
And that wasn't the only reason I'm here, Sal. I need your expertise.
I haven't got any of that.
I was going to say, when you find it...
Yeah, exactly. When you find it, let me know yourself, if you could. Because, you know, 58 years, I'm still searching myself.
58? I thought you were older than that.
Cheeky.
Come on in, come and take a seat. How can I help?
Over the last few weeks, I've been in extreme pain. It's unbearable. It's literally, I'm swelling up. I'm still swelling up. A hair, but around here is so painful, and it just was. It feels like I want to stick a knife in to let all the pressure out.
How long has it been going on for?
Quite a while, but over the last couple of weeks, it's got a lot worse. And it's right here and right all around here. The pressure is just so painful.
Okay. Does it disturb your sleep?
Yes, I'm up all night. I can't sleep. I'm just so drained. I'm just so tired. And then when the pain kind of dies down, it's like my stomach starts to pain as well. And then I go to the toilet, and all of a sudden, it's just like gushes of blood comes out.
What's this? This is a special machine I talk into, and then someone else listens to it and writes up letters for me. It's pretty good.
Dear colleagues, I'd be very grateful if you could see this man in the next few weeks about his problems, full stop.
I've tried to contact you on the phone several times, but unsuccessfully, full stop.
So that she is now a vegetarian, that this was entirely, sorry.
This was entirely, sorry. This was not, this was not, I was tested her for full stop.
She's got a raised ALP and an abnormal gamma GT.
I'm writing to you for advice about whether I need to do anything. Many thanks for your help.
Yours sincerely.
Many thanks for seeing her, yours sincerely.
In the meantime, full stop, with thanks and best wishes, yours sincerely.
Blood is not there all the time. It's like my stomach swells up, and it just, when it gets really painful, then I got to go to the toilet, and then the blood just kind of gushes out at me, and then it's like my stomach kind of goes down.
Okay.
And that happens like every couple of days.
Okay. Now, you've had bleeding from the back passage before, and they examined you under...
Yeah, I've had a couple of operations. Well, I think 3 operations now on my bowels. But it's just too much. I just can't cope with it anymore.
So we come up to the couch. I'm just going to have a feel of your tummy. Would you be comfortable with me examining the back passage?
Yeah, fine.
So what I'm going to do is I'm just going to draw the curtain round. If you come and have a lie down here.
Yeah, I'm ready.
All right. Oh. Now, if any point this is uncomfortable, painful, and you want me to stop, just let me know, OK?
Yeah.
Any pain there?
Yeah, there's always pain there.
OK, that's all done. I'll leave you to get dressed. You let me know. Do you want me to give you a hand in any way?
No, I'll be fine. Thank you.
OK. You all right there?
Yeah, it just takes me out of breath.
There's a couple of things to check out here, Victoria, because it's obviously been going on for a couple of weeks. Now, as opposed to giving you pain relief, I'm actually stopping one of them, which is naproxen. We can book you in for blood tests, and I need a sample of urine. I'm going to have a chat with Dr. Graham about your history, but I think I'll probably be referring you to have a bowel check done. Is that OK?
Yeah.
OK.
All right, thank you.
That's all right. I'll give you a hand with the door. All right. Yeah, take care. Thanks. Bye-bye.
Bye, thank you.
Could you just give me a short description while you
I've got a rash compilation which will in my back without my arms. It's basically I'm falling apart right now.
Here we all.
Well, mine's going quite fast.
What, your age?
Yeah.
Let's have a look.
How are you?
Not too good. It's just I got this mad sensation in my ears at the minute.
We've got an 111 report saying that you rang them. Was it yesterday?
It was like last night. Yeah, I went to A&E, but then they just said, I need to see a GP. They said there's nothing really that they could do to help me there.
OK. So did they have a good look in your ear?
I didn't feel like they did really look. She was just kind of just to see if I wasn't dead, kind of, if you know what I mean. Like that's like I do know I've had blocked eustachian tubes before, but now it's starting to hurt where that is, like, and it's like a burning like sensation, like someone's put an ear out, like a cigarette out in the middle of my ear canal.
OK.
And I just don't know what it is.
So when did you start having earache?
Maybe a couple of weeks ago. See, like right under there, like if I could drill in there, that's where the pain is exactly.
Don't.
I know, I'll try not to, like, sore, and I've got like this weird feeling of like rushing wind into my ear. It feels like my eardrums or something's about to just explode or something.
Is that there the whole time, or is that coming in? Sort of
that comes in like episodes, like every 2-3 minutes. Like I just get it because obviously nothing's there, so it makes me feel like, whoa, is there something? Yeah. Constantly makes me feel like that all the time, like.
Are you from Northern Ireland?
Yeah, I'm from Belfast.
How long have you been in Bristol then?
Just about 1.5 years now.
What brought you over here then?
Oh, the music scene and stuff like that's like really good, like music.
Pretty cool, isn't it, in Bristol?
And that's why, because I make music.
What kind?
All sorts of stuff, like.
35. Temperature's normal. And have you got headphones on a lot?
No, I don't actually use the headphones a lot, but I am exposed to loud music a lot. Like it's like electronic music, so it can be like loud music. Yeah.
OK. And I presume you don't wear any ear protection?
Not really, no.
It's definitely would be worth something invested in if you're
definitely
exposed to a lot of loud music regularly, because otherwise you're going to permanently damage your hearing.
Yeah.
And, you know, by the time you're 50, you'll be going, what?
Yeah, that's not good. Like, I don't
to everyone and everything. Right, have a stand up for me a second. Let's have a look. So which ear is it that's painful?
Like both of them, really.
So any pain here?
Not immediately. It's
any pain round here?
No, not that I can feel.
Okay, let's have a look in this one. Okay, so your eardrums actually look really healthy. It's definitely not sort of any nasty infection going on your ears. So I think it is probably your eustachian tubes again.
Yeah.
Okay, have you ever been to see the ENT specialist?
No.
Ear, nose and throat?
No, I have never been referred to them, no.
Okay. Your allocated GP is Dr. Barnard. I can have a chat with her about getting you to see ENT. But the most important thing that you can do is to get some really good ear protection.
Yeah.
So in terms of treatment that you can do now, try some ibuprofen, 2 tablets of ibuprofen 3 times a day for just the next couple of days. That will try and really reduce any inflammation down.
Right.
I'll have a chat with Dr. Barnard.
Right.
Have a look at some ear protection, ibuprofen, and come back if anything changes.
Cheers.
All right, take care.
No problem.
See you later.
Thank you. Cheers.
Between 4:30 and 5:30?
Yeah, I'll be in.
Is that okay? Home number that ends 308?
308.
Yeah, that's fine.
308? That's more checked up, isn't it? Were you an astronaut or something?
No.
Hello. Very efficient. Well, you trained him well, didn't you?
Come on in, come and take a seat. So I think, Ilaria, your English seemed fine last time, didn't it? Do you feel that we need to get an Italian interpreter? It's okay, isn't it?
Yeah,
really?
I want to try. I need to learn English.
Yeah, so all your blood tests are looking fine. And has this lump that you felt here...
I have a small, but not like last time when I came here.
I'll have another feel now, if that's okay. Is it all right if you just pop your jacket off there? So I'm just going to have a...
No, it's fine.
I mean, I felt all of this last time, and that whatever it was, I can't feel anything now.
Yeah.
Everything feels totally normal. Yeah, OK. Was there anything else you wanted to ask me today?
I have anxiety. I feel like panic. I'm too emotional. I feel depressed. I don't sleep well. I don't want to take any tablets.
And when did you come here from Italy?
I came in 2015.
OK. Are you settled in a job here, or are you looking for a job?
I was working, but I look for a new job now. Tomorrow I get the appointment in job center.
Oh, good. OK, so you're looking at the job side of things.
Yeah.
And how many flatmates or housemates do you live with?
5.
5,
Yes.
OK. And do you have a partner in your life at all or not?
No, I was in a relationship. I had a bad relationship. And, I don't trust, to be honest, I don't trust in love.
OK. So you're carefree and single at the moment?
Yeah.
And no sort of, with you when you were younger or now, no risk of kind of self-harming?
No.
No, it's more anxiety.
Yeah.
Yeah. I think you're right that we don't need tablets to help with that kind of thing unless it's something that's so persistent and you can't get out of bed and that you're not functioning.
I think too much. I always...
Yeah. But what might help is perhaps looking into ways of managing the anxiety better or improving the anxiety symptoms, OK?
Okay.
So there's a service here called Bristol Wellbeing Therapies. I'll just give you a leaflet about it. They can talk to you about anxiety, how to manage the symptoms better. Because we all have some traits, don't we? Some of us worry more, others are different. So if you know that and it can help you a little bit, it might be helpful. And how do you feel about that?
Good.
Yeah? And then you're working positively to that. You're going to the job centre tomorrow.
Yeah.
Your blood tests are fine, not worried about your physical health. OK. And
I always check up about my, a little bit hypochondriac.
OK, about the health side
because
of
when
things.
my mama, she had cancer,
Yeah.
when my granddad, daddy had cancer,
Yeah.
I feel more apprehensive.
Yes, worried
So I want to check everything, it's all right.
So I think physically not to worry. If there's any symptoms, you can come back and talk to me or
Yeah.
talk to us. OK.
Okay, thank you very much.
That's all
Lovely
right.
to speak with you. I like.
No problem. Pleasure. Nice to see you.
Thank you very much.
That's all right. Nice to see you. Take care. Good luck with all the job things tomorrow.
Thank you. Thank you. Lovely. Have a nice day.
Bye-bye.
I still haven't had that chest X-ray.
Right, OK.
But-
Hi. Hello. Are you partner? Yes.
Not partner.
No,
Right. Just a friend.
Just a nosy friend.
Right, are you OK? Are you happy for her
cool,
to be in here?
Yeah.
Right.
No, she just wants to tell you about the pain I had last night. I think it was angina attack, and that's what the GT spray's for, isn't it? So I sweated, right, OK? And it was like a ball in my chest, right, OK?
Mm.
And I took the GT spray.
Yeah.
2 lots and it went.
So, so you've had a heart attack about 2 years ago now, isn't it? So generally, do you get angina pains?
I do get pain,
Yeah.
yeah.
And when do you tend to get those pains?
Any time I could be.
So how often are you getting them?
You're
getting them a lot, aren't you? How much is a lot?
You have them.
Yeah, but I don't know whether it's chest infection, because I got a cough at the
Okay.
moment, and I'm bringing up green
Okay,
phlegm.
we'll assess that in a second.
Yeah.
So you're getting pains, though?
Yeah,
So
they're-
how often are you getting these pains?
Every-
And what are the pains like?
I don't know, it's like a tightness of the chest,
Yeah.
and then I sweat,
Yeah.
and then I take the angina spray, and
Yeah.
it goes. You know what I mean?
Okay, so it sounds like angina then, doesn't
Yeah,
it?
yeah.
If it goes with the spray, I think that's the most
that's right. That's what the
likely.
surgeons
Yeah.
told me at the hospital.
Yeah.
That,
Have you been getting them most days since the heart attack?
yeah, not every day, on and off. I
Right.
get good
Okay.
days, I get bad days.
Yeah. In terms of your angina, I'm a bit concerned about that. Almost daily pains is very frequent, isn't it?
Yeah.
Hello there. That's a good T-shirt.
Thank you. Primark is the way forward, or Primark, however you say it.
Like your T-shirt. It's
Oh,
nice
thank
and
you.
bright, but
It is
sort
bright.
of dark at the same time,
Yeah,
isn't it?
yeah, a bit of sunshine.
Yeah. That looks like a good thick jacket.
Nice shirt. I like that.
I haven't seen you before, have I? He remembered somebody as smartly dressed as you.
I realised when I left the house that I was wearing all blue, and I was a bit worried that it looks like I vote Conservative.
Now, in terms of your chest,
Yeah.
you said you're coughing up green muck.
Yeah.
How long has that been for?
Last few days, well, because I stopped smoking again. I've been about 20 days now. I haven't had a cigarette for, you know what I mean? So.
Right, let's see what your blood pressure is.
Right.
Okay. No, well, so don't. Don't talk. Okay, it's too high. All right. Let me have a little listen to your chest. Can I pull this up at the back?
Yeah.
Okay. Deep breaths. Okay, a bit wheezy, not too bad. Okay, let's get a chest X-ray. I'll request it again, but go up this time.
I've got tomorrow.
You're going to nag him. Excellent. Okay, now we need to add in something for your blood pressure.
Oh, is it all right?
So you're on amlodipine. So we need to add in ramipril. So go for a chest X-ray tomorrow.
Yeah.
Start this new tablet, 1 a day for a week, then 2 a day. Okay?
Cool, yeah.
Book an appointment with the nurses for a COPD review as well.
Yeah.
Okay?
Okay, yeah. Yeah, cool.
And then we'll try and start to sort everything out.
Remember when, before I never had a movement in my foot? So I bought one of those circulation boosters, right, okay? And
No idea what that is.
No?
So in which
It's a thing
case I
you sit
don't...
on, and
Yeah.
look, I can move my foot, and I moved it for 2 years.
Brilliant.
Oh, yeah, I bet you're excited about that anyway. Yeah, time to go, sharp exit, quick camera.
Right, so book an appointment for 2 weeks, yeah?
Cool, all right, thank you.
Okay, bye-bye. Bye-bye.
Hello, can I help?
Yes, please. I think I've got an appointment for the treatment room.
And the name?
Guy.
No, you've got an appointment on Friday at 9 o'clock. You're diabetic with you on Friday, my lovely, yeah. All right.
It's all right. Well, I written it on the calendar as Monday.
Right.
Had a text
No,
reminder.
you usually text the day before, so hopefully you'll get the text Thursday. Yes, Friday at 9.
Thank you.
All right, no problem. We'll see you then. Take care, bye-bye.
Gaynor Pocock, please. All right?
Yeah. Not really.
Well, you wouldn't be here. It's one of those stupid questions, isn't it? Those doctors. I've probably been saying it for the last 20 years.
No, fine, thanks.
OK, I'm Dr. Bolam.
Yep.
What can we do for you?
Well, going back last year, I had a growth on my leg. And I feel, or I think, I got another one coming.
So last year, did you have it removed?
Yeah, I did.
And what was it?
Some sort of carcinoma, was it? Something
It
like
was a
that?
cancer, was it?
I think so, yeah.
OK, shall I have a little look?
Yes.
Seeing as do you think it's the same thing, do you?
Well, I can remember this is how it started.
A squamous cell cancer. OK, let's have a look. So the previous one was here.
It's near enough sort of opposite, really.
Right, quite a wide excision, didn't
Yeah,
they?
yeah.
Yeah, OK. So tell me about this then. How long's that been going on?
This one's about a month.
What's it doing? Is it bleeding or anything?
No, not bleeding, but I just know it's there.
You know it's there.
And it's raised more in the last, that's why I've come.
OK, it
started to raise. That's how the other one started.
OK, so it's pretty much the same as the other one, is it?
Yeah.
OK, all right. Yeah, and do you protect yourself from the sun?
Yeah.
OK, all right, I'll refer you back. Was it similar size, the one that was removed?
That's how it started, but by the time I got there, it was like about this, about this big.
OK.
And they didn't ask me for a follow-up or anything, they told me. They just said, if you get anything, just go straight back and get straight back up here.
I'll do the urgent referral, all right, because we like to get rid of those. If it's the same thing, we do like to get rid of those quickly, OK? So that means you will get an appointment in the next 14 days. And you understand that, obviously, we have to say this because I have to tick a box. You understand that it's obviously it's a potential squamous cell cancer again. You understand that?
Yeah.
OK, all right, so this just tells you about the urgent referral scheme, tells you what to do if you don't hear from anybody in a few days' time. All right?
Yeah.
Give that number a ring. Okay?
Yeah.
Is that all right?
Yeah, that's fine.
Okay.
That's lovely.
All right.
Yeah. I'm just glad I come and got it rolling.
Absolutely. Yeah, absolutely. Okay.
Yeah, thanks
All
very
right
much
then.
then.
Okay.
Thank you.
No worries. Bye-bye.
Okay, Jackie, can we grab a seat? Are you in trouble?
What?
Are you in trouble?
No, it's only two.
It's to do with your back again, I think.
No, this is to do with the cancer bit.
Oh, right, OK.
My brother's had gene therapy.
OK.
So they've sent letters out to the family, just so I can get an appointment. They said they'd send it to you.
Right, OK. Let me have a look at this, because this is not what I thought you were coming back about your back.
No, touch wood, it's fine.
Oh, good,
really,
good. Oh, good, all right.
I can't be more happy with it. It's like I'm young again.
OK, and you have mentioned the business with cancer before to me,
Yes,
haven't you?
yes.
Family history bowel cancer. This is your brother, you say?
Yes, and my mum's had it as well.
I presume you've come here with the letter. You'd like to have this.
I certainly would, yeah, definitely.
Yeah, OK. Genetic testing is used to find out if someone is carrying a gene that might predispose to a particular condition. People are counselled before any form of genetic test is carried out. It is very important that people understand the potential benefits of testing, such as early diagnosis and possibly even cure of a condition that otherwise would be very serious. But they also need to realise that there are risks associated with testing, particularly the anxiety as you go through the test, and also if something is found of a serious nature. Have you thought through all the implications of what it would mean if it was positive? Or
Yeah.
Tell me what you would do if it was positive.
Well, just do what the doctors say, really. It's down to them, innit? I'm not sort of one of those who gets fazed with anything.
Okay.
It's just...
OK.
Because I've had a scan with the camera up there, and that was all clear.
OK. So, but if it was positive, I think there'll be three implications. One, I think, is that they would want to continue to give you scopes quite frequently.
That's fine.
Yeah, OK. Secondly, I suppose, in theory, that there might be an implication in terms of sort of insurance in the future. So, you know, if they knew that you were an increased risk of a particular condition, that the insurance companies might take a view on it. The third thing is, I suppose, there would be implications for children as well. You got kids?
Yes, I've got two, yes.
Yeah, so, I mean, if you had a positive test...
Yeah, that's my brother explained a lot of this as well.
Then they would have the decision to make that you've had to make, and you know, that would be putting that on...
But I think I'd rather
down to them, and so they
stay alive a little longer.
Yeah.
Then sort of say,
I'm sure
forget it. Like,
we'd all like to stay alive a bit longer.
Yeah, definitely.
OK. All right, so I'll make a referral to genetics service. OK, and you'll get the letter through the post.
Excellent. Thank you very much.
All right, OK.
Thanks.
Cheers.
Just with somebody can hold. Carol?
Let's wait.
Let's wait. There you go, Carol. Take care. Bye. Hello. Sorry, my lovely. Can you hear everything? I put it on hold. I put it on hold. When I put it on hold the other day, it played music for me. There's obviously something wrong with this blooming phone. Yes.
So, what's happening today?
You tell me.
I saw you about 3 or 4 weeks ago, yeah?
Yeah.
And the main problem is your knee at the moment.
It's my hands as well.
And your hands as well. You were trying out a little bit of having some morphine.
Yeah, it helps, but it don't take it away.
No. And apart from that, what are you taking painkiller-wise?
I've got these patches on.
Yes.
Naproxen.
Yeah.
And then...
And paracetamol.
Yeah, and the other one's on a night...
Amitriptyline.
You're rattling soon.
Yeah, you are on quite a lot.
I got it in this side of the hip as well.
Yeah.
And my shoulder.
Yeah.
Because I think you seen my missus last week.
Yes.
And I tried to do everything for her, but I just can't do it.
Yeah.
In the mornings, it's like, I can't move them.
Yeah. Which bits of your hands are affected? Do you want to just show me?
Yeah, it's all in the knuckles.
Right, in these ones here?
Yeah.
OK.
And it's the same with this one, but I think it's swollen this morning.
Yeah. If I press, say, on that joint there, does that hurt?
Yeah, a little bit, yeah.
It does. And this one here?
Yeah, they're tender.
Yeah. Okay. And did anybody do any blood tests to see if you had an inflammatory arthritis, something like rheumatoid or...
He said it was osteo.
Osteo.
Yeah.
Yeah. So I am wondering whether we should maybe repeat those bloods and maybe even get you seen by a rheumatologist, just to be sure that we're not missing something.
Anything that'll get rid of it.
Yeah.
Ease it off.
And do you think you need a bit more help at home with your wife?
I've got a granddaughter, but she's at college.
Yes.
Because Heather, when she stands up and sits down, that's it. She can't do nothing.
No.
And I can't get in the bath now because of my knees.
Yes.
So we've put in for a walk-in bath or a shower or something.
Good. That sounds like a good idea.
I haven't had a bath for, I can't remember.
Yeah.
I got in there one day, I couldn't get out.
Right. Okay.
So I just have sort of strip washes now.
Yes. And how are you feeling about your caring responsibility? Is it getting you down a bit, do you think?
Yeah, because I worried about Heather, because she nearly died last year. Yeah, I just...
So I think we ought to put you on our carer register, I think, shouldn't we? Yeah, because you definitely are her carer. If you weren't able to do what you are doing, then somebody else would need to. And it may be that it is time to think about whether you need some more help at home. So the way to get it in Bristol is through an organisation called Care Direct.
Yeah.
And we have a carer coordinator at the practice called Heather. She can contact you and see if there's anything else we can help with. Would that be all right?
Yeah, that'd be great.
Yeah. And I'd like to book you in for another set of blood. Is that all right?
Yeah.
Okay.
Yeah, well, falling apart. Works on me like it ends up dead.
I'll see you again,
Right,
OK?
lovely. Yeah, thanks.
Bye-bye.
Bye.
Stephen McDade? Hi, come and have a seat. What can I help you with?
My partner required that I came.
Yeah.
We were out on Saturday.
Yes.
And Foot Park, and I fainted.
Right.
And she's a nurse. And
Yes.
she was pretty much after that, taking my pulse the whole day, and she kept telling me I had an irregular heartbeat.
Right. So take me back. Exactly what happened with the faint?
To be honest, I hadn't drank anything all day.
Yes.
And we were on our 5th ride.
Yeah.
And I came off and I could hardly walk.
Yes.
And I just fainted.
And did you start? So you started feeling unwell.
Yeah.
Did your vision change at all?
Yes.
What was it doing?
Kind of blurry.
And then you just
fainted.
Fainted. And do you know how long for?
A few minutes, I think.
And then other people were around you, were
Yes,
they?
yeah.
Did they notice you shaking or anything like that?
My partner did, yeah. She said that I was shaking and I just went to the floor.
OK, before you went to the floor?
Yes.
Yeah, but you didn't think it looked like a seizure?
No.
No. And then when you came round, how did you feel?
Very shaky, sweaty.
Yeah.
And eventually, after a while, I was actually sick as well.
OK.
I found out Saturday that there is history of heart problems, and like my dad's got low blood pressure, my mum's got high blood pressure,
right,
and my granddad died of a heart attack.
And you look much better.
Yeah,
let's face it.
I do.
Yeah, your nails are done, your makeup's done. All right.
Yeah.
That's a good noise, isn't it? Thank you for wearing shorts. Nice, easy knee examination.
I just want to check if there is Dr. Graham running late. She said, I'm not even going to bother to check. She never runs late.
That's not actually entirely true. So if you find you feel a bit weird on it, then you just have to take it off.
They are. If I go weird, you know why.
Any weirder?
Oh, thanks, Doc, yeah.
OK, boys, it's time to go. Sorry.
He's got a rash on his back and it's not seeming to go down, so I just thought I should just get it checked out.
Oh, yeah.
It's really only on his back, like there's an odd one.
On the front.
You've got one or two, haven't
Yeah.
you? OK, you can put your T-shirt back down and have a seat now. How long's it been there?
Well, probably since like Saturday evening.
Maybe, yeah.
So not very long at all.
Because I went to the woods on Thursday
Yeah.
with cubs, and I came back and I felt
fine. And then on Saturday, my back started itching, and they had a look and they saw a rash, and then on Sunday it got a bit bigger, hadn't it?
And is it itchy?
Yeah.
It is.
When sometimes I can just feel it itching, I try not to itch it, but
Very good.
sometimes it's just itching so much
Yeah.
that I just can't resist it.
Fair enough, that's very honest. And do you feel ill in any way?
No, I don't really
No.
feel ill, it just...
Okay, well, I think what we'll do is we'll just take your temperature and your pulse, okay? See what that shows. I don't think it's anything too worrying, okay?
Okay.
That's totally normal. Let's take your pulse. Just have a wrist. That one will do. That's fine. Okay, and have you looked it up and thought about what it might be?
I gave an Piriton to take the itching away, and then I just did look up chicken pox.
Yeah.
Because he hasn't had that.
Right.
Piriton, it helped a little bit.
Well, it's great stuff for stopping itch of any type, okay? So I think that it is possible that something in the wood irritated your back, okay? And that you're a little bit allergic to it, and so you've got this rash. It looks a little bit like nettle sting, and it's behaving a bit like that. So you're not ill in yourself, but it is a bit itchy, and that's about it, really. It's there.
I did see some stinging nettles.
I'm not saying that it's caused by stinging nettles, I'm just saying it's a bit like a stinging nettle rash, and it's probably due to an allergy that isn't anything to do with stinging nettles, it's just something that was in the wood. You're doing the right thing by giving the Piriton, which is giving him some relief from the itch.
Yeah.
And that's probably all that needs to happen.
Carry on with the Piriton then?
Yeah.
Okay.
Yeah. Is that
Brilliant.
all right? Yep.
Thank you.
Good. Okay.
All right, thanks.
Great.
Okay.
Thank you.
Can I have a little listen to your heart if you lift your top up for me? Okay. Just check your pulse. Just follow my finger with your eyes. Not seeing double at any point. And you felt completely well since Saturday?
Yeah.
Yeah, OK. And do you drive at all?
Yes, I do.
Yeah. So I need to look up the DVLA guidance and what we need to do.
Am I going to lose my licence?
I don't think you're going to lose it, but you might be temporarily not able to drive while we do some tests.
Okay.
It sounds very much just like a simple faint.
Mm.
It's just now this kind of thing about your partner reporting that you had this irregular pulse. That's the kind of complicating factor. Though I think you must not drive for the time being until we've done the tests. Does that sound annoying?
Yeah.
Yes. OK, so tests will mean some blood tests, an ECG, and then what you really need is a monitor you wear for kind of 24 hours that will pick up any irregular heart rhythms and things. So till we've got all those results back, no driving for the time being.
I can drive home?
Would be no. You'd have to get someone to come and pick your car up for you.
OK. Give my dad a call, because we only live up the road anyway, so...
That's fine. OK, then, and we'll take him in there. And if you have any more episodes, we need to know about it.
OK.
OK.
No problem. Thank you.
Bye.
Oh, no, look at her.
Not from me, it's from the uncle.
Haven't got an uncle.
Bring you my wee. Oh, thank you. I love it when patients bring me wee. Okay.
Why have you brought me wee?
I've had a urine infection. I get them semi-regularly, so I know what the symptoms are. I got it Sunday mid-afternoon, actually, probably.
Yeah, that's very specific.
So I basically spent the rest of the afternoon backwards and forwards from the bedroom and bathroom.
Urgency?
Yeah, I need to go right now or I'm going to wet myself.
Yeah. Pain?
The first bit of wee is fine.
Yeah.
And then it's the very last, dribble, stings, and then my body feels like it's squeezing a sponge, got the very last bit out.
Okay.
And then I release, and then I'm like,
Okay.
isn't this feeling amazing for about a minute? And then I'm like, oh my God, really need to go for a wee.
Go again. Okay. Any tummy pain at any point?
I've had some tummy pain kind of here.
Anything high up around your back?
No.
Any blood at all that you've seen?
When I wiped, it was slightly pink.
Okay. Okay, yeah, so yeah, you've got a urine infection, definitely. So we'll give you some antibiotics.
I'm allergic to penicillin.
Won't give you that. But no other allergies apart from...
Plasters, wool. I'm allergic to a lot of...
Wool?
Wool makes me come up in a rash, some shampoos make me...
It's the ginger gene.
It is.
I'm a closet ginger as well, and I had a bit of a reaction to, what was it, fentanyl after an anaesthetic, and the anaesthetist said, oh, it's because you're fair and ginger. Apparently it's a really common thing to have sensitivities. The most common cause of urine infections is sex. Yeah, so always empty your bladder after sex, and then just the obvious other things like wiping front to back, which I don't know who doesn't, so... And just making sure that you're drinking plenty as well. Just have a quick feel of your tummy, just have a lie down on the bed for me. Right, just check that you've not got any nasty pain anywhere.
That does feel quite uncomfortable.
There. Okay,
Yeah.
that's all right.
Yeah, that's...
There, okay. That's all right. Okay, all right, so just lower down. This is over your bladder, so that's fine. Right, I just need to get a signature for this.
Yeah.
If you have a seat back in the waiting room, and I'll bring this out to you when I've done it in a minute.
That's wonderful. Thank you.
All right.
Bye.
See you in a sec.
Do you feel any better now?
Yes, I do feel a bit more relieved.
Nice to see you both.
Thank you.
Bye now.
Bye, Carla. Nice weekend.
See you next week.
I'll see you next time.
Thanks for your patience.
That's what I am, a patient.
Yes.
Okay, bye-bye then. Bye, Dumbo.